All right, so after we take the heart rate, we move on to blood pressure. And so there's some equipment that you need to have prepared for this. This is the blood pressure cusp, and so this whole black Velcro thing is what you wrap around the patient's arm. And you have the pump right here, which you pump up to put air in here, and that's what gets it tight around their arm. And so before you begin, you got to make sure this is twisted all the way to the right, righty-tighty, lefty-loosey. So when you have it all the way to the right, that's how you close it off so that air actually pumps into here. Otherwise, you'll keep squeezing and nothing will be happening. The meter, so when you pump it up, you can gauge how much air you have in by how high the numbers are. And you listen for the pulses with the stethoscope. When you put it in your ears, make sure that these prongs are facing forward, not backwards. Even though that's what you think it should be, you face it forward. And double check to make sure it's on by twisting. You can twist this and tap on it. So you hear, right now it's not really making a noise in my ear, but when I twist it, then I can hear it. And so that's how you know if your stethoscope is on and working. Otherwise, you might be sitting there and be thinking this person has no pulse, when really your stethoscope is just turned off. And then you have the patient put their right arm up on the table, and we use the right arm just for consistency throughout all the tests. So what you're going to do is you're going to try to see if you can find a pulse on their brachial artery. It's usually towards the inside of their elbow, around here. And you kind of just take a little mental note of that. And you're going to wrap the cusp around their arm. Keep it snug but not super tight. You just don't want it to have it loose and wobbling around. So you put these in and put the head of the stethoscope right where you had that pulse. And double check to make sure this is all the way tight. And you're going to squeeze. And by doing this, you pump air into the cusp. So I'm going to pump it up again just so you can see in the camera what's going on. So we have it up to about 200, and then we slowly let some air out. And that's where I heard my first thump, and you can see the dial bouncing up and down. And the last thump I heard was at about 64. So I got about 118 over 64, because that's where I heard my first thump, heard more, watched the dial bounce up and down, and about 64, I didn't hear anything anymore. But essentially what you're looking for is when you release the air, you'll see the dial go, and you'll begin to hear thumps, usually around 120. That's just kind of an average. Some people might be a little higher, a lot of people are lower than that. And what you're hearing here is the first thump is their systolic pressure, so that's when the heart has contracted and that's their highest pressure. And you'll continue to hear light thumps, and the last thump you hear is the second number you record, and that's their diastolic pressure, and that's when the heart is relaxed and it's refilling with blood. A lot of times people are a little scared of because it's kind of the more challenging one, but with a little bit of practice, you guys will be stars.